well. So these are all techniques that can be done with that. And I'll show you some of that. So this concept of using it to remove anterior bone osteophytes here at this space right here is something that, for example, Dr. Ashkenazi, Ali, and Dr. Geyer and Harrell, and some of the other people have used to remove osteophytes that you would have otherwise had to do a full corpectomy to remove. And so these are 30 patients where they did just that. They were able to gain access to osteophytes in adjacent vertebrae, eliminating the need to do a full corpectomy, if you will. So from one ACDF or one corpectomy approach, you can do the next level's ACDF decompression as well. And you can see the outcomes of that, the fact that the decompression was adequate, was good, and was effective in relieving the radicular symptoms. Here's an example. You can see on the MRI, 69-year-old male with severe myelopathy from what's called the segmental OPLL type thickening and osteophytes. And you can see what they did was they did a one-level corpectomy, which means 2, 3, 4, 5, a C5 corpectomy. And from the C5 corpectomy, they reached around and they decompressed all the elements behind the C6 body and down to that. And then they did an ACDF underneath the C6 body. So they were able to undercut it and preserve the C6 body and not have to do a full C6 corpectomy. In other words, they got all the bony compression, but managed to save a good portion of the load-bearing portion of the C6 vertebral body and allow you to do a short corpectomy cage and an ACDF cage with 3-point fixation, which obviously biomechanically is much better than a long corpectomy cage in terms of rotation, inflection, extension, stability. So you can see the arrow pointing out where they had reached under and cut out that central calcified PLL ligament, and how they did a very nice job with that. So multi-level compression, saving bony attachment points, saving vertebral bodies. That's another benefit of the extended cervical applications of these tools. And there you can see an intraoperative video or lateral fluoroscopy showing how he's reached the curved tool through the corpectomy defect right here, and we're undercutting the posterior aspect of the cervical C6 vertebral body. But you see, we're reaching here all the way up to halfway up the vertebral body. So again, you know, sparing the need. In other words, people say, how do you decompress right behind the vertebral body if the PLL is calcified without taking the vertebral body? And this is an alternative right there as well.